Hello everyone and welcome to the INFORMAS webinar. So my name is Stephanie.
Bienvenue à cette session.
I'm a public health nutrition scientist
Je
based in Belgium.
suis scientifique de la santé publique, la nutrition de la santé publique.
INFORMAS, or more specifically the Healthy Food Environment Policy Index, on behalf of our Food AP leadership team. So I guess most of you already heard or have been involved with the Food AP before, but so this is the original index as we have used it since the beginning. So there's about 7 food environment policy domains and then 6 infrastructure support domains like leadership, governance, monitoring, and so on. And the entire index is composed of about 48 good practice indicators on which governments are evaluated. So in terms of the process, the key idea is to bring an expert panel together in each of the countries who's going to conduct the evaluation. The biggest job is actually to put the evidence document together to really look in detail for each of those 48 indicators.
Pour qu'on puisse donner les détails, les actions et les politiques que les gouvernements ont élaborées et mises en œuvre. Et en termes de gouvernement, les documents, le document qui n'est pas utilisé par les experts pour remonter l'essentiel de l'argument. Et en fonction de ce que nous avons identifié, please, we would like to know if you still get the feedback from the interpreter. We're asking the host to reassign the interpreter.
And then there's the priorities. So actions are actually prioritized both in terms of importance.
I think it goes and comes. So if it
can the chair inform the host to reassign? I think he's not reassign the interpreter. That's why the feedback is going to the flow. If the chair could inform the host to reassign, we've sent him a message, but it's not done it yet.
Was to fast track changes to the health star rating scheme to address anomalies, design issues, and make the scheme mandatory for all packaged foods by July 2019. So in terms of uptake, you can see on the right of the screen that the Food AP is actually one of the most popular INFORMAS modules. It's usually the one that countries take on board first.
For now, we are holding the interpreter until the host has assigned the interpreter. Thank you.
Because then it's more clear where the gaps are, which other modules are a priority to further measure and monitor. So the Food AP has been implemented in more than 40 countries to date. And the advantage is as well that we now have sufficient countries in different regions to do some benchmarking within the region. So an example from Europe, 2 European projects, Stop and Pen, which funded Food APs in about 11 countries. And this is currently being wrapped up. So we will soon have some data on benchmarking the implementation of food environment policies across Europe. So that's interesting. We are seeing the same in Africa, where quite a lot of countries are implementing the Food AP. And generally, they also use a common set of indicators. So they work together to adapt the indicators and then apply the same tool across these countries. So that's interesting that we can do that. There's also a few countries that are repeating the Food AP, and of course that's the whole idea because it's a monitoring tool. So New Zealand was the first country in 2014 to implement Food AP, and so has since conducted another 2 Food APs, so to evaluate the government after each term. Then something else interesting is that the food AP can be implemented at different levels of jurisdiction. So we have implemented it across 40 countries. But for example, Australia, Canada also implemented it at the provincial or the state level. Canada even implemented it at the city level. And it was seen that still about half of the indicators were still applicable at the city level. So where cities actually have some jurisdiction to improve food environments. And then we've also implemented it at the supranational level, because Europe is also a jurisdiction which can implement some policies. So these are some of the key priorities that came out of the European level food AP. So recommendations for the European level. So some examples are, for example, require member states to implement restrictions on the marketing, especially online marketing of foods, high in saturated fat, trans fat, salt, or added sugar to children and adolescents up to 19 years old. In terms of infrastructure support, one of the highest priorities was to develop a high-level NCDs prevention strategy. Also, for example, to benchmark food environment policies and support and coordinate the exchange of good practices between European member states. Some multi-country analyses have been done. This was the first one, and it's actually comparing the implementation gaps across countries internationally, and we see that there's quite some variation. Actually, none of the countries is really having a high proportion of indicators evaluated at high implementation, because countries generally cherry pick some policies. In terms of the actions, of course, the priorities are very different from country to country, but generally, we can see that the most popular policy areas, among which priorities are recommended, are firstly increasing taxes on unhealthy foods, front of pack labeling, and restricting unhealthy food marketing to children. Probably not surprising, but these are the most popular policy areas when it comes to selecting key priorities for government. There have also been weightings that have been developed for the different indicators based on the literature, so literature review, but also a Delphi with experts. I'm not going to go through the entire methodology. You can always go back to the original paper. So some countries have introduced some innovations where, for example, also governments were involved in the ratings. It was a separate exercise, but they did some self-evaluation by government. Then they brought together, for example, the priority actions that were put forward by government and those put forward by experts, and they had a consensus meeting to come up with the final priorities, like in Thailand. Some countries added a few context-specific indicators. Some countries already took into account the double burden of malnutrition, which is important, but originally the food AP focused on reducing obesity and chronic diseases. And as I said before, the capacity building and the collaborations within the regions were quite interesting as well. So to work with the same tool and process so that we can compare implementation gaps. So the food AP is important, not just because of the scorecards and the outputs, but the process is very important because it engages really in the country with a broad expert panel and also with governments, because government is involved in validating the evidence on implementation, and they are also invited as observers in the process. And so it's really important because it starts some awareness on food environments. It shows where the gaps are, and it sets the scene for more work in this area, perhaps implementing some other INFORMAS modules as well. But then, of course, we know that obesity is one pandemic. We also indeed have undernutrition, we have climate change. And that's why we are currently also working on an index to evaluate governments on the extent of implementation of policies to create healthy and sustainable food systems. So while the food AP focused on the food environment, we are now developing an index to look at the entire food system. So this is ongoing. The way we are doing that is first conducting a scoping review on the impact of food systems, actions and policies on nutrition and the environment. We also incorporate inequalities as an outcome. And then based on that, we are going to conduct a Delphi study with international experts to really prioritize the double and triple duty actions that can be taken by governments to improve food systems. And these are going to inform the new list of indicators for the new index that we are developing. And then we would do some more in-depth work in Africa as well. We would do a mapping of policies and also some stakeholder interviews to see whether these indicators would be useful, whether they are appropriate to be included in the new index. So we've used a whole range of reports with recommendations on healthy and sustainable food systems. And ultimately, so before the Delphi process, we reduced the set of 300 indicators to about 48 indicators in the end. So for the new index on healthy and sustainable food systems. And so for each of those, we are conducting the scoping review to see what impact there is on obesity, undernutrition, the environment, and inequalities. And these will also be incorporated in the Delphi, which we are going to conduct next year. We also want to better measure the impact of the food AP. What impact does it have on actually increasing accountability of governments to take more action? And we want to think more about how can we guarantee sustainability of this tool and process. Can we embed it within other existing monitoring initiatives at the global level? Is there a way to use less burdensome data collection methods, for example? So that's a brief update on the food AP. If you have an interest in applying this in your country, feel free to get in touch with us. Thank you very much and enjoy the rest of the seminar.
All right, thank you very much for the presentation. I have posted the link through which you can access the presentation, especially for the first part where we had some disruptions with the interpreter. And so we move on to the next session, which is a brief presentation on the experiences that we have had implementing food AP in Uganda and Tanzania. I will share my screen. So my name again is Milka Wanjohi. I am a research officer at the African Population and Health Research Center, and we have been working with colleagues from Uganda and Tanzania to implement the food AP tool. So my presentation will mainly focus on the processes that we have and the approaches that we have used in Uganda and Tanzania, some of the adaptations and innovations that we have incorporated into the tool. And later, my colleague from Uganda will talk briefly about the experiences, including the lessons that they have learned, challenges, and some of the facilitators. So the aim of the food AP exercise in both countries is to assess the extent of the government's implementation of recommended policies to create a healthy food environment, and to also identify priority actions for the government to take forward in order to create a healthier food environment. So we are using the food AP that was developed by INFORMAS and which Stephanie has just described. And this is also part of a larger project, which we are calling the RICA project, being implemented by the World Health Organization, IDRC and IDLO, together with or in collaboration with the governments in Uganda, Tanzania, and Kenya to develop a package for regulatory interventions for healthier food environments to prevent diet-related NCDs in the 3 countries. So the tool that we are using has the different components that have been described, but we have included a few more indicators in the original food AP tool. So we have the tool that are categorized into 2 groups. We have the policy domain components, which includes food composition, labeling, promotion, prices, food provision, food in retail, and trade and investment. So we have 25 indicators within these components, and the original tool has about 21 or 22 indicators. So we have added a few more indicators around food composition, food promotion, food provision, and food in retail. The next component around infrastructure and support domains within the food AP tool is around leadership, governance, monitoring and evaluation, funding, platforms for interactions, and health in all policies. Again, we have included a few more indicators specific to our context around leadership, as well as monitoring and evaluation. And each of these indicators has a set of international best practices that have been compiled by the INFORMAS team, and against which the government actions and the policies around creating a healthy food environment are evaluated. So in terms of the process, the implementation of the food AP process, we are using 4 or 5 main stages. The first stage involves documenting and verifying relevant government actions and policies through systematic searches and information requests to different government departments, and compiling all the evidence and into an evidence pack. The next stage involves convening a panel of stakeholders from both non-government and government experts to review and validate the evidence that has been compiled into the evidence pack. The third stage involves rating, based again on the evidence that we have gathered, working with the stakeholders or a panel of experts to assess the extent of government actions in creating a healthy food environment against the policy stage cycle and also against international best practices. We have completed the first 3 stages, and we are now in the 4th stage currently, which involves prioritization and recommending actions that the government and its partners should take forward in order to create healthy food environments. We have also included a 5th component that is not in the original food AP process, which is key informant interviews to explore further the lessons that have been learned, facilitators and barriers in implementing food AP or food environment policies in the 2 countries. So in the first stage, which is the evidence review and the compiling an evidence pack, we have used about 6 steps, or it entails about 6 steps. The first step involved stakeholder mapping, just mapping and listing the different government and non-governmental organizations that would be relevant for each of the domains and the indicators, and also stakeholders who are in a position to provide relevant evidence around policies and actions by the government around the different indicators that are included in the food AP tool. The next step involved website searches. So after mapping the different stakeholders, we went into their websites looking for evidence around policies by the government or any actions by the government around the different indicators. And for each of the policies or actions that we found, we mapped them into Google Forms and extracted pieces of information that were relevant into the food AP template, which would later now form the evidence pack. So in addition to website searches, we also had academic database searches such as PubMed and Google Scholar again, looking for information or evidence of the policies and actions by the government around the different indicators and domains. And we use search terms or key terms that were associated with each indicator. For instance, if it was around food labeling, we'd have specific search terms for food labeling or food prices or governance and leadership as such. In addition, we also had a lot of the stakeholder consultation, again, looking or requesting for information around policies and actions, especially those that were not available online, or for government departments that did not have websites or where we couldn't find any websites. So we consulted different stakeholders that we had identified during the stakeholder mapping process and requested for information. There was also a lot of snowballing and referrals to different departments and different key people who would have relevant information. The fourth step involved formal document requests or official requests to the different government departments, especially for documents that are not available publicly. So eventually, after compiling all the evidence, we identified a few key informants or people who seem to have a lot of information around policies and actions by the government in the different domains, and shared the evidence pack with them just to review and recommend any further evidence that would have missed or fill in any gaps that would have we still have in the evidence pack. Also to mention that the stakeholder consultation process was very helpful in terms of identifying actions by the government that were not necessarily available online, such as establishment of technical working groups or documents that were still under development, meaning that we couldn't find them online. So the next step after having the evidence pack compiled and complete, we organized an evidence validation workshop, which involved bringing together stakeholders and key informants who are knowledgeable around the different indicators and domains that we have in the food AP, both from the government and the non-government institutions, to review the document again and recommend any actions or any policies that would have missed out. In Tanzania, we had this activity as a face-to-face workshop. We shared the evidence pack that we had with them, and they had a time to review and discuss in groups and recommend any further policies or actions that we had missed, and also verify that whatever we had in the evidence pack is a reflection of what is available in the country. In Uganda, because of COVID, we couldn't have the face-to-face workshop, so it was a virtual validation meeting. The country leads presented the information that we had in the evidence pack, indicator by indicator, and allowed time for the stakeholders to interrogate the evidence and provide any information that would have missed. So all the new evidence that we received from this validation workshop was incorporated into the final evidence pack. This was also an opportunity for us to clarify or make clarification with the stakeholders on some of the information that we're not sure about. Most importantly were the documents that we found a bit old, and wondering whether there were any other documents or new updates on those documents, and any other actions that we might have missed during the evidence compilation process. So with the evidence pack compiled and validated and all the additional information from the stakeholders incorporated, we are in the process of organizing rating and prioritization workshops, which is the third step in the food AP process. Again, this is done by a group of experts, ensuring representation of the people who are experts in the different indicators or domains as much as possible. So the first step will involve rating the government actions, again, based on the evidence that we have compiled, by the level of implementation against international benchmarks or countries that are doing very well on a certain indicator. and then also rating the actions against the progress that it is along the policy cycle. So for implementation against international best practice, the question that we're asking is how well the different indicators are implemented compared to international best practices or benchmarks. And we have a 4-point scale that we are using for this rating. For the rating against the policy cycle, the question that we are asking is where or which phase along the policy cycle that particular action or indicator is. And again, we have a 4-point scale that we are using for this rating, whether it's at the agenda setting phase or policy development phase, implementation phase, or evaluation phase. So after the rating exercise, the next step involves suggesting or recommending the most appropriate actions that would move the indicators or the practices forward. And after proposing the action, the next steps involves ranking the actions in the order of importance, extent of significance or value, and also ranking them in the order of feasibility or achievability. So that's what we have done in the process that we are using. And we have made some innovations on the original tool. And one of those innovations or adaptations that we have made is to include new indicators to capture undernutrition or the double burden of malnutrition. And secondly, we have included key informant interviews, which will be done as a follow-up of the rating and prioritization exercise. So in terms of the new indicators that we have included, the rationale is, as Stephanie has mentioned, the food AP mainly focuses on overnutrition, obesity, and diet-related NCDs. But the issue of undernutrition is still of huge concern in our sub-Saharan context. We're also having a lot of recommendations now globally on having double duty actions or interventions or platforms to address all forms of malnutrition. And earlier on in 2017 and 2018, we had implemented food AP in Ghana and Kenya. And one of the major recommendations was to make it sensitive to the double burden of malnutrition. So that is why we have included new indicators to make the food AP sensitive to creating a healthy environment, but also capturing double burden of malnutrition indicators. So in terms of developing these new indicators, we have summarized the whole process into 4 stages. The first step involved gathering evidence. So looking at different recommendations on food environment related actions to address the double burden of malnutrition from various sources globally. Much of this work had been done earlier by INFORMAS project and other related projects, documenting different food environment related actions to address the double burden of malnutrition. So we had 69 actions identified. So out of these 69, we had to select fewer and the most suitable actions for inclusion in the food AP template. And we selected 12 actions, mainly with considerations around the focus. So there are many actions, there are different focuses on the different actions. Some of them focused on the health system, but we picked or we prioritized the actions that were around food environment. And we also considered the issue of feasibility, not to select too many actions that would overload the food AP tool, given that it has about 47 to 50 indicators originally. So adding more or many more actions would overload the tool. We also had recommendations on including food safety indicators from all the countries where we have implemented food AP in Kenya, Ghana, 2017 and 2019, but also during the stakeholder engagement activities in Ghana and Tanzania. So we added a few more indicators around food safety. So after selecting the 12 actions, the next step involved identifying where these actions would fit within the original food AP template. And a few considerations we had here is to make sure that the food AP tool remained comparable to the original tool as much as possible. So we did not edit or make any revisions on the existing domains or indicators. We added these 12 new actions as separate indicators within the existing domains. So the next step involved developing benchmarks for the new indicators. So the 12 actions were included in the food AP tool that we are currently using in Tanzania and Uganda. So this is a summary of the new indicators that we have included into the tool. Within the policy domain indicators, we have included an indicator around large-scale food fortification in the food composition domain. In the food provision domain, we have included an indicator around providing workplace support for breastfeeding, and also policies for provision of safe drinking water and hygiene and sanitation, or WASH. Under the food retail domain, we have included a new indicator on having policies and regulations for food safety, especially focusing on the food, informal food sector. Under the infrastructure support domains, we have included breastfeeding or having breastfeeding and complementary feeding policies under the leadership domain. And a few more indicators in the monitoring and intelligence domain around having indicators and monitoring systems for breastfeeding and complementary feeding, food safety, and also having growth monitoring programs focusing on both undernutrition and overnutrition. So this is just a comprehensive list of the different indicators that we have developed and the domains where we have included them. So besides the new indicators, we have also included a component on qualitative interviews that will be done after the prioritization activity. So the reason or the main aim of including these qualitative interviews is to understand and document why some of the policies and indicators are well or poorly implemented. Also documenting the lessons that have been learned so far, especially for the indicators or policies that are well implemented. What lessons can we learn moving forward? And also challenges and barriers in the implementation of the policies and indicators that are not doing very well. So in terms of the challenges or experiences, just generally, because my colleague will come in shortly to talk about an in-depth experience in implementing the food AP. So for the facilitators, the fact that we are implementing this activity as part of a larger multi-stakeholder project has helped us in terms of identifying the different stakeholders who are involved in the different domains of the food AP, and also being in the space where people are talking about government policies and actions has helped us to know where to find what documents that we can include in the food AP evidence pack. So we also did, prior to the food AP activity, we had done a lot of extensive stakeholder engagement. So most of those stakeholders within the government and also the non-governmental organizations were aware of what was happening. So it was easy now to approach them when the time came and ask for information, request them to review the documents. We have also learned a lot of lessons from Ghana, Kenya, and Senegal that had implemented the food AP tool earlier on, and also a lot of support and capacity building by INFORMAS team. In terms of challenges that we have experienced, the main challenge is actually accessing documents, especially those that are unavailable online or in the government websites. And in some cases, we had some of the officers reluctant in sharing the information with us. So again, the process of requesting official requests for information that is not publicly available in some of the cases involved protocols that were lengthy. COVID challenges. At some point, we had some of the offices closed, especially the government offices. So getting information became a challenge. There was also a lot of political tension in both countries. In 2020, it was an election period in Tanzania, and 2021 in Uganda. And around this time, we had a lot of challenges getting any information from government officers around policies and actions by the government. And at some point, we also had internet bans in Uganda. So people are mainly working from home. Without internet, it became a challenge to access documents. So I'll stop here and invite my colleague, Tony from Uganda, to share in-depth experiences implementing the food AP module, the day-to-day experiences that they have had, just briefly. So over to you, Tony.
Okay, thank you, Milka, and good afternoon here in Uganda. Yeah, I'll go straight, given that Milka has already provided a lot of background information. So straight to our experience implementing the food AP tool in Uganda.
Hi, sorry, Tony, just a quick interruption. So because the breakout rooms are timed, we may be timed out of the breakout room, but we are working on it so that if we come back, continue your presentation. So in case you're talking and it times out, we're working on it. Thank you.
Okay, that's fine. So the first thing I want to talk about is regarding institutional review board approval processes, that is IRB. Okay. Yeah, so I was talking about the IRB processes. Our experience in Uganda is that it's a very important step that has to be taken. Research ethics committee or review board approval, because during the document search and reviews, for example, if you go to visit a government office or ministry, department, and agency, you realize some of the government offices will put you to task to first confirm to them whether this research project is ethically, I mean, having ethical considerations that are approved through the institutional review board. So that is one important thing that we note from our experience. Without it, obtaining some of the required documents from the government offices may not be possible. And the other thing is, which is critical, is early preparation for submission to the IRB to go through the processes. You realize that you may have, as a country team, different researchers in that team. And here in Uganda, the experience is that each of the team must have some recognized sort of training or qualification in regard to research ethics. So that's very important. Then the other important experience and lesson we learn is that a project launch, an official project launch is really critical, and it provides an entry point for developing relationships with the government officials and experts that we interact with in the course of preparing the evidence pack. So through the project launch, like for the case of Uganda, we managed to get in touch with different policymakers within the Ministry of Health and other relevant ministries like Agriculture, National Drug Authority as an agency, plus the Bureau of Standards, which keeps checks on standards. So all these, we came together during the project launch, invited them, and we managed to get exchange, network, get contacts. We kept the contacts, and that was, the contacts were very helpful during the time when we now needed to access documents, so we could communicate easily. Then capacity building, this is something that was mentioned by Milka earlier. It also helped us a lot as a country team. We had a session with the INFORMAS team, I think led by Stefan. So the session was aimed at capacity building, taking us through the INFORMAS model. So that also helped a lot. It made us to understand the different the details of implementing this model, the domains and the different indicators that we have to compile evidence on. Then not all relevant documents are available online. So the experience is here is that there is need to intensify the search for documents through physical means. For example, visiting the offices of the ministries, departments, and agencies, and visiting libraries. These governments, some of these government offices also have libraries. So both libraries for government agencies and probably academic related libraries within universities are very helpful. At first in Uganda, we thought we would do almost everything online, but the experience and lesson is that that is not the case. There is a lot of physical search for documents, which may be hard copy documents, and probably some of the things that the research team may not be able to see online. When you go for physical search, if a hard copy document, policy document is not provided, you might be provided with some online links that you could have not seen before. Then academic articles are equally important during the evidence compilation because you realize that you may not get some of the evidence you are looking for or the policy documents, but there are journal publications and maybe working papers and other forms of articles that may be academic related that can highlight some of the policy milestones and progresses that the country is making. Some of the academic articles have actually done even policy reviews on some of the issues that are being examined under the model. Then the next experience and lesson we have from Uganda is that if you are a team, I mean, if you are working in a team, there is this, you know, question whether you should allocate tasks to the team members, that is the research team, based on the food epi domain or probably indicators. So these are some of the key considerations that for us we had to go through and take. What we did in Uganda is that at first we allocated the different food epi domains to the different research team members. And you realize we have around 13 domains. So, and we were 3. Each of us had about 3 or 4 domains to review. But along the way or in the course of the exercise, you realize that when I'm reviewing documents for information regarding domain number 1, 2, 3, I will come across information relevant for a domain which is being reviewed by my colleague. So what we do in such a scenario is that I don't ignore this information. I have to compile it on the site alongside with the domains that have been assigned to me. And so at the end of the day, we don't miss any sort of relevant information that each of us is is coming across. So that was helpful. The thing is that if you are doing the document review and you have divided domains, do not only, kind of look at strictly the domains that you have. You should as well be able to capture information that you come across and are relevant for the rest of the domains, because at the end of the day, the evidence part that is being developed is for the entire team. Then the other thing is that there is...
I'm very sorry to interrupt, but we have to wrap up soon. So if you could wrap up within the next 5 minutes so we can move back to the plenary. The other session is done.
Okay, yeah, thank you. So a team can also divide policy and academic related documents, and then also the physical search of documents. You can also decide a team member to be following up on that. Then some of the information is hardly accessible. So we kept our eyes on the ground in terms of following news items that are related to policy developments, policy related and government programs in terms of events that are taking place, maybe some of the program launches, intervention launches, and political and leadership pronouncements. Then consistent checks are important. This is in terms of M&E within the group. We also had in-country expert reviews before the validation exercise. This was very helpful because by the time we went in for validation, we already actually got most of the missing information that we didn't have. The exercise can be done virtually. I think Milka mentioned that. Due to COVID-related restrictions in Uganda, we successfully did it virtually. And then use of different search engines is important. You don't have to stick to only one search engine. Google Scholar, Thesaurus, PubMed, and among others. Then some of the documents seem to be outdated, but that may not be the case because the experience we have with government of Uganda is that you find a policy document is dated back maybe like 2003 or 2005, but the information that comes through during the validation is that once a policy document has not been updated, that is the document that is still in use. So it still applies much as it looks very old. Then shared working file, this is important for teamwork. Challenges, just to add on what Milka mentioned, beyond online document search, there is need to plan for resources to ensure physical document search. So for us, we had that as a bit of a challenge because initially it was not thought so much into detail that it will cost us to do physical search. Then government officials are slow sometimes to respond to document requests. So we have to engage them a lot and give a lot of constant reminders, and engagements are important to be official. Unavailability of documents online, I've already talked about that. Then you also realize that the food AP work is really having a wide coverage of issues that affect health, from nutrition to trade-related issues to physical policies like taxation.
I'm sorry. I'm sorry if you can hear me. We would have to move back to the main room for the next session to begin. Thank you.
All right. Yeah. Actually, that was the last. Thank you.
Thank you.